In a gold mining town in eastern Congo, a virus started spreading in January 2026. Nobody knew it yet. For 4 months, nobody would. By the time doctors understood what they were dealing with, it had already become the largest Ebola outbreak in Congo's history. This is the story of a rare virus, a broken warning system, and the outbreak that outpaced everyone that came before it. It began quietly near MMWR, a gold mining hub where thousands of workers move constantly between camps and cities. Fever. Stomach pain. Vomiting. The early symptoms looked exactly like typhoid, and that mistake would cost the region months. Field tests were calibrated for a different strain of Ebola entirely. Again and again they came back falsely negative. Cold chain failures delayed lab results even further. For nearly 4 months, the virus spread undetected across dense mining networks. On May 15, 2026, the Democratic Republic of Congo and Uganda officially declared the outbreak. 2 days later, the WHO called it a global emergency. What followed was unprecedented. Case numbers climbed 5 times faster than any previous Ebola outbreak in the region's history. By July, confirmed cases passed 2,000. International medical teams began evacuating infected aid workers to hospitals in Europe. By late July, the outbreak had surpassed every previous Ebola epidemic in Congo's history, the largest ever recorded there. Nearly all of it concentrated in Ituri province, in 6 crowded health zones including the city of Bunia. Hospitals themselves became dangerous. Over 150 healthcare workers were infected simply trying to treat their patients. Personal protective equipment ran short. Clean water was scarce. The very places meant to heal became places people feared. Meanwhile, armed conflict tore through the same region, militia violence forcing response teams to suspend contact tracing entirely. Families fled into overcrowded displacement camps, where poor sanitation turned close quarters into ideal conditions for the virus to spread. And in a region shaped by mining, thousands of transient workers kept moving between camps, carrying the virus with them. Traditional funeral customs made things harder still. Community trust in outside health workers had worn dangerously thin. Burial teams sent to prevent further spread were sometimes met with suspicion, misinformation, and open hostility. By week 30 of the outbreak, over 500 new cases and nearly 300 deaths were recorded in a single week. It was the epidemic's deadliest moment, the exact week the outbreak became the second largest Ebola epidemic ever recorded worldwide. Across the border, Uganda took a different path: fast diagnostics, strict contact tracing, and disciplined isolation protocols. By late July, Uganda had completed 42 days of surveillance with 0 new cases, and declared its outbreak over. Back in Congo, the crisis pushed the world's health systems into motion: new diagnostics, new trials, new urgency. In July, the WHO approved the first rapid field test built specifically for this strain, cutting diagnosis time dramatically. Clinical trials for new vaccines began in the United Kingdom and Canada, the first ever built for this specific strain. And in Bunia, a new 100-bed treatment center opened its doors, the largest dedicated facility built for this outbreak. A joint Continental Response Plan was launched, 14 operational pillars, and over $500 million to fund them. But every expert who has studied this outbreak agrees on one thing: the countermeasures alone were never going to be enough. Real containment takes trusted diagnostics, safe operating conditions, and communities that believe the people trying to help them. That's the real lesson here. Subscribe the channel. Please like and share with your friends.